There are lots of questions you might be having, and you sometimes feel shy, or you don't get time, or you don't get your doctor's time. So you try to Google it. So this time we thought the commonest questions that everybody has, and we try to answer. Hi everybody, I'm Dr. Sunil Dachepalli, Senior Orthopaedic, Robotic Joint Replacement, Arthroscopic Surgeon at Yashoda Hospitals, Somajiguda. So let's look at the commonest questions. The first question is it okay to work out with a broken bone? Now, common sense tells us no, isn't it? But the thing is interesting, if you have a broken hand bone, why should it stop you walking? So what I suggest is, because the most important thing is all of us should have some form of physical activity. The expected walking is at least 10,000 steps a day, so that you're very active. Like let's suppose I have a broken hand bone. Now we give what is called splintage. Usually after 3 weeks, when the bone becomes reasonably sticky, we want to keep moving the fingers or the wrist. The reason being, it should not go into stiffness. Otherwise, if you leave it for too long, immobilized, it's going to become very stiff, and to recover from that is going to be a big task. So always discuss with your doctor. Now the second question, does exercise affect bone healing? Yes, absolutely. Now, doing the exercise, as we all know, has lots of benefits. Number one is the simplest change in mood. It gives a hormone called endorphin. After the exercise, your mood changes, you're happy, less stress, things will improve much better. And the next thing is, let's suppose we have a broken bone in the thigh and it is at rest mode for long. So you're not putting weight, thereby you're losing calcium, and you lose the muscle because you're not exercising, and the joint becomes stiff. So 3 main things. So what I suggest is, go according to your doctor or discuss with them what exercises can you do whilst it is healing. That's the best part. So let us suppose I have a thigh bone fracture and it's been 6 weeks. Now we should be able to bend the knee with protected environment. Like, you have a splint or something that will allow bending the knee. So you bend the knee, do the exercises. As it is progresses to, let's say, 2 months post fracture, you can start strengthening exercises and also a bit of load bearing. And some of the patients are allowed to do swimming, because swimming takes off your weight. And also you can do walking or treadmill in the swimming pool. So these are the things that you're going to discuss. And the other non-impact exercise like cycling. Let's suppose if I have lower limb fractures, I can do my upper body exercises. So always remember, any exercise is good provided it is guided properly. Let us look at the third one. Why do some people experience popping or picking joints, and should we be concerned about it? That's a very nice question, because a lot of us, when we're walking, especially going up and down the stairs, we hear the clicking sound. There are different age groups. Let's take the youngest age group. We see the clicking sounds. So that could be associated with an injury before or without. Without injury, some people can have lax joints. That is, the joint ligaments are not taut enough or the muscles are not on enough. So you have this popping sound or clicking sound. Or you might have some problem with the soft tissue, that is, the smooth things in the joint. So that can cause a popping sound. And also dehydration can again cause stiffness of the joints and clicking. And if you go to the middle age group, that's when you start wearing out your joints, or you would have had injuries before. So that can lead to some popping or clicking. And if you take the elderly age group, usually the arthritis, so it can be degenerative we call, or if it's a younger age group we call rheumatoid. So the different types of arthritis that can wear out the joints. So when the wear occurs, the smooth cartilage cover is gone. So what happens is, whenever you're moving the knee joint, so if you see, that is how the joint surfaces are covered. So if you see there, the ends of the joints are always smoother. If you see all around there, that's where the weight is borne. But if it's worn out, you'll hear that grating sensation even under the kneecap. If you have pain more when you're going up and down stairs, especially when you're bending the knee, that tells us it's coming from under the kneecap. So my suggestion is, see your doctor early. All it means is probably a little bit of exercise, that's all. No surgeries or tablets. Or if it's a little bit elderly age group, we might suggest simple injections. Now, if you go for injection earlier in the phase of arthritis, that is stage 1 and 2, it might benefit you. But if you go very late at stage 3 or 4, it's useless to take injections because it's not going to help you. So don't waste your health and your money. See your doctor soon. Probably you might be lucky if it's caught early. They might suggest simple exercises. Coming to the next question. Does drinking water help lubricate the joints? Yes, of course. What is joint? It is a smooth surface where the bone is moving. And obviously, if you want it to be smooth, it has to be hydrated. And what is there in the joint? Water. So that is called the joint fluid. So majority of your joint fluid is made of water. So obviously, if you're keeping yourself well hydrated, all this will have a good hemostasis. Thereby, the joints are better. What happens if you're dehydrated? The body tends to pull up the fluid from all over your body, including the joints, your bone ends, your cartilage ends. So the cartilage becomes more brittle. The bone becomes more brittle. You're leading to more damage. So that is why try to keep hydrated as much as possible. It not only helps in the joint, but it also helps in your overall body mechanism. And also, if you're regular in taking your fluids, you might lose weight as well. So I suggest all of you to try to keep hydrated as much as possible. At the same time, don't overdo it. The next question. Can you dislocate a shoulder just by sleeping the wrong way? Probably yes. The reason being, if you look at any joint, so this is the shoulder joint. If you look at the joint, there is something called muscles and also ligaments. So they keep the joint stable when you're trying to move it. Let's suppose the shoulder. So if you see the muscles and ligaments, that's keeping the joint stable. But if you had some injury that you have not treated it properly, so the muscle or the ligament is torn, and you can have dislocation in whatever position. We have seen one of our famous Indian cricketer who keeps dislocating his shoulder whilst playing, and suddenly he tries to put it back. So this does happen. That's because the joint ligaments are weak. Now, why do you dislocate when you're sleeping? When you're sleeping, your body is in a pause mode. So your muscles are relaxed. So the only thing that is working in the joint is the ligaments at the time. So when you're in some awkward position, like your head up, your hand up behind the head, so this joint can become weak and you can dislocate. It does happen to many people. So I would suggest all of you to take early opinion from your doctor. The reason being, people are scared nowadays to sleep because they're worried they might dislocate the shoulder. The simple thing, if you take your doctor's opinion, they will examine you. If required, at the most, they'll do an MRI scan. Now, the funniest part is a lot of people are worried about MRI getting radiation. You should all understand MRI is a magnet. It's not CT scan. CT scan gives radiation, but not MRI. So the reason we do MRI is we want the whole picture in your joint, not just the bones. So my suggestion is go for an MRI, look at the soft tissues. There are ways just to overcome this. You need to strengthen the muscles around your shoulder joint, thereby decreasing the chance of dislocation. But there might be some people, in spite of some physiotherapy, things are not working. So in that scenario, we might have to do a simple keyhole surgery and just fix whatever is torn, and you are getting back your life. So that is why my suggestion is don't just tolerate everything. After all, we have only one life. You want to be happy and healthy in this life. We're all there to help you, and all the best. There are lots of doubts about the joint replacement. Can your knee replacement make you magnetic? I'll put this question easier for you. So lots of times when we go for MRI, the first thing the MRI technician asks us is, do you have any metal work, so that you should not have an MRI scan? Because we have seen instances people are stuck to the MRI machine because that's a magnet. So if you have anything like iron that has more affinity for magnet, you have to worry. But majority of the implants is what we put inside. Even if it's a fracture where we put plates and screws, or if it's like some nice knee replacement like this, wherein you can see this is made of zirconium or oxynium. These are very inert materials. So you can feel free to have an MRI scan. If you're not very sure about what was inside, I would suggest to contact your doctor who operated on you. And also my friendly advice to most of you who is having operation from now on, please ask your doctor what is the company that has been put inside, what is the implant type, size if possible, and also what material. All of you should have it. The reason being, even we go through the airport, there is a metal scanner, you all beep. So, and also it helps to know what is inside. Let us suppose you have a knee replacement, and usually this lasts from their statistics for almost 30 years. So let's suppose I've done this, and after 30 years only this middle portion is worn or the top and bottom are good. All I have to do is just a half an hour job, take out the middle bit, change it, and you're done. Unless I know the company and the material it is made of, I won't be able to help you. In that scenario, what I'll need to do is I have to change whole of the knee. Similar is the scenario if it's a hip replacement, shoulder replacement, or even if it is any fractured bones that are dealt with plates and screws. So my suggestion is ask for a sticker that has all the details of the implant. That is much easier. Right, so let's move on to the next question. Do you need to replace your knee every few years like a car tire? I should thank you for asking that question. The reason being, some of the people are worried to have knee replacement because somebody known to them might have told that don't have knee replacement because once you have had it, there is nothing. If it becomes loose, you're done. You can't even walk, which is not true. If you take a knee replacement, for that matter, if you see, this is like just having a cap. Like, all of us gone to the dentist. We have caps, dental caps. Similarly, wherein your knee joint is, worn out, what we do is we just put the caps on both ends with a smoother surface like a high density polyethylene. So usually the statistics come from the particular companies, and what happens is we have joint registries, we follow them, and some particular companies will last for about 30 years. I worked in the hospital where the first joint replacement occurred in the world, the hip replacement. And you'll be surprised, as I was, that some lasted for 40 years. I myself revised, that is, took out the loosened joint and replaced it with something else. The gentleman who was done in 1966, I have revised in 2006. How many years did it come for? 40 years. So that is fantastic. But is that the case with everybody? No. It all depends on the surgeon who has more experience, and also the type of implant we put in, and also the important participation from the patient. So these are all the important things. If you're quite active, doing your exercises regularly, and if you have had a nice implant from a good surgeon, why not? I'm the evidence. I was there doing that after 40 years. So similarly, there are lots of products that are coming in which can last easily for 30 to 40 years. That is the first one. So the longevity has increased. They're being designed to work for millions of cycles. That is how the product comes out. First it goes into R&D. They test like we walk. They have special robo machinery that keep moving similar to how we move. They try twisting, turning, jumping, everything like we do our day-to-day activities, and see how long or how many million cycles it comes to. So they have been tried and tested. And worst scenario, let us take that it is loosened. We can always take it out and put a new one. That is called revision knee replacement. Yes, you have to go for one step higher, but we are still doing second time, third time, fourth time. You can do how many ever times you want to. But thing is, the technology has improved so much that it will allow, but you have to approach a senior doctor who's experienced in doing revisions. And I have a very nice question at the end. Can you develop a robotic walk after knee replacement surgery? This is a very nice question. The reason being, you would expect to walk like a robo because you have a metal joint. Well, like I said, I worked in the hospital where the first joint replacement happened in the world. This is called hip replacement. And we have observed people like, this started in 1950s. 1960s, 70s, they became reasonably popular. And in India, we have been doing more often since 2000s. So there is something called forget hip. The patient forgets that he had a hip replacement. That includes doing robotic surgeries. We do lots of robotic surgeries so that we mimic that particular patient's morphology, their ligaments, their way of walking, everything, so that we try to give back as normal as possible. Now, your question about whether you will walk like a robo is not seen very commonly. The reason being, the robo is just metal or hinges, whereas human body has lots of other things. We have flesh, we have tissues around, blood supply, and also cushioning like from the fat, skin, all these things. So it doesn't exactly mimic like a robo, but you might walk with a bit of stiff joint. But if you're having some advanced surgeries like robotic joint replacements, we try to balance to the best so that the soft tissues would function almost near normal. I hope you answered your question. Thank you.